Hello everyone, my name is Ronald Mark Robbins, and today I'll be talking about the coronavirus. No more dine-in restaurants, no more movie theaters, no more partying, no more hanging out with friends, and no more toilet paper. No more enjoying the perks of life. This is the result of the worldwide phenomenon going on called the coronavirus, or scientifically, the COVID-19. I have spent the last month in isolation, away from my friends and away from my classmates, and I gotta tell you, it sucks. I also have done some further investigating into this matter, looking into the World Health Organization, the CDC, and worldometers. Today, I would like to brief everyone on the symptoms, the number of people affected, and the prevention of this deadly virus that is COVID-19. But first, let's examine the symptoms of this virus. The coronavirus is defined by Melissa Conrad Stopler, an MD from MedicineNet, as a type of common virus that infects the humans, typically leading to an upper respiratory infection. Symptoms can occur at any time and any place, just like a common cold or fever. Low-level symptoms may only last for a couple of days, but if it's not treated properly, you may be looking at a couple of weeks or even a month. Most symptoms seem like allergies or a fever, but there are also severe cases with worsened symptoms. A more common or low-level symptoms include nasal congestion, runny nose, sore throat, or diarrhea. These symptoms usually go away without any special treatment. Severe cases, though, may consist of symptoms such as trouble breathing or bluish lips, persistent pain, or pressure in the chest. Severe symptoms can last up to 3 to 6 weeks, sometimes resulting in death. Seeing as this virus has the same symptoms as a common fever, does the coronavirus have the same widespread as the fever as well? The coronavirus is an easily spreadable infection that has affected many families, many businesses, and many jobs. COVID-19, as of March 26, 2020, has contracted over 500,000 cases worldwide, resulting in over 23,000 deaths. 1,000 of those deaths are here in the United States, as of New York Times. The virus can spread through the air by coughing and sneezing, close personal touch, touching an object or surface contaminated with the virus, or rarely, fecal contamination. Certain communities are more susceptible to the coronavirus than others and contract more serious cases. According to the National Institute of Health, people at higher risk include those over the age of 65, people with high-risk conditions such as chronic lung disease, moderate asthma, serious heart conditions, or diabetes. As for me, I actually have one of these conditions. I have asthma, and as I try to keep social contact to a minimum, I'm still worried for my own self-being. Now that you understand the symptoms and the range of COVID-19, let's discuss some countermeasures. We will consult both the prevention of the virus and, if you already have the virus, steps that you can take to help better yourself. If you do not have the virus, there are some precautions that you can take to prevent yourself from getting this. The easiest step to stop spreading is simply to keep clean hygiene, including washing your hands, taking showers, and not to touch your eyes, nose, and face. The harder prevention method is to maintain social distancing by keeping a 3-foot distance away from all people and staying at home if you feel unwell. If you manage to go out to society while feeling unwell because you absolutely have to, you are at a higher chance of obtaining the actual coronavirus. If you yourself think you are sick or display symptoms of the virus, please follow the guidelines that are here provided to minimize the spreading of the coronavirus. The number one action you can take to help others not contract the virus is to stay at home. If for some unforeseen reason you have to get out of the house for food or water, cover all your coughs and sneezes. Or, better yet, an alternative is to wear a face mask. And while you're wearing this face mask, it should be cleaned every day or thrown out daily. Lastly, monitor your symptoms throughout the week. If you start having worse symptoms consisting of worsening cough or difficulty breathing, contact your closest healthcare department and seek professional help immediately and find an opinion that works for you. In summary, looking at all the data collected, the coronavirus is spreading rapidly at an ungodly speed and affecting many different types of people. As a community, we can prevent the virus of this killer disease, knowing the symptoms of COVID and following the recommended guidelines for suppression and quarantine. I have no idea when the coronavirus is going to end, and I have no idea when we're going to be terrorized by this pandemic. But if we all work together, we can stop the virus in its tracks and live life as it was intended to be. Thank you.